The whole reason I got into the industry is because my mom had lost her sight temporarily when I was in high school. It turned out it was multiple sclerosis. That was how I kind of got interested in the eye industry. Lived in the Southeast for most of my life and in Arizona for 4 years, outdoorsy, hiking a lot. And then when I moved back here to the Southeast again, out on the lake a lot. So a lot of sun exposure in my history. Eventually wound up a few years ago with what turned out to be a squamous cell carcinoma on my nose. And then after they removed that surgically, another little lesion popped up on my eyelid on the same side. So it had me concerned that it was possibly a spreading.
This is caused from the sun, okay? That's years and years of exposure with no sunglasses.
I don't think I got the skin cancer as a result of what happened in the 2 or 3 years leading up to it. I think it was a lifetime of UV sun exposure.
Because the tissue around the eye is the most sensitive.
As a doctor, I know that I'm supposed to stay and protect myself, from the UV damage that goes on. But as a patient, I was stubborn in the past. But so now, as doctor and as patient, I'm very conscientious of how much UV that I'm getting exposed to. I got to go through what it was like to have the worry and the kind of guilt, I guess, and looking back on my lifestyle choices and staying out in the sun, not using any sun protection. And even now that I know that I've had a cancer and it's removed and I'm cancer-free, I'm still at risk. So it's not just because they've surgically removed the element that gave me fear. I've got to prevent the fear from growing any further by protecting myself with UV protection. I'm kind of overly aggressive with making sure that patients understand the risk of being exposed to the elements.
Well, most sunglasses that are bought in the mall are not UV protected.
In regards to the eye, some of the consequences of UV damage, of course, skin lesions, that's the primary thing. You can have cataract formation that is accelerated. People will still get cataracts, but it accelerates the process. So there's also retinal damage that can possibly occur as a result. It's going to accelerate that process with sun exposure, so we don't want to step on the gas pedal with tissue damage. When I'm recommending sunwear for children or adults, I want them to consider polarized lenses.
We always recommend polarized lenses because that's still the best lens for your eyes.
Want ultraviolet protection, preferably anti-glare as well. Because if it's a fashionable pair of sunglasses, that's not what I'm concerned about. I'm concerned about, is there coverage? Are we actually protecting the lid, or is there light getting around the sunglasses? You'd think that's a dermatology field, but it is. The eyes are a common place for sun damage to occur. In regards to sun protection for the eyelids, yeah, we think sunscreen, but yeah, most people don't get sunscreen on the eyelids because it sweats into the eye. So really, you're limited to sunglasses.
We want something to cover everything around the eye.
I remember when I was a kid, growing up in the 70s, it wasn't about anything about protection. We didn't know that much as far as what the ultimate damage would be. So I ran around. I was an outdoorsy kid, and most kids do like to go out and have fun. The thing is that's where most of the sun exposure occurs. They spend a significant portion of their time outside. It is important to expose the parents to the risk of what their kids are going through by not wearing sun protection. Because we think, they got young, healthy skin, they look great, they're invincible, and they feel invincible, and we think of them as flexible and fixable. I think a lot of the eye care community has failed to get the message out as far as UV protection. A lot of times patients come in with a fix me now attitude. They don't think of the prepare me for later part of the message. It's hard to come out of pocket sometimes. They see it as an extra charge. They don't see it as really a medication necessarily, but in a way it kind of is. We use sunscreen. We pay for sunscreen to apply and reapply. I want to look at each patient as that's somebody's family member. And so whether they want to take care of themselves or not, I'm kind of the advocate for the family, for the people who love them, that I'm going to take care of their eyes. A lot of people don't tend to take care of themselves as well as they want to take care for the ones that are around them that they love.